Hi there, this is Brian. Let's figure out what we need to do when a doctor wants to place an art line. First things first, we need to gather our supplies. As the nurse, we're going to be gathering our art line tubing, which looks like this. We need a 500cc pressure bag, a 500cc bag of normal saline, whatever kit your doctor wants, whether it's radial or femoral, a pressure cable that'll go to your monitor, and that's that. The next step is we're going to need to prime our art line tubing. So we're going to take our tubing out of the package, being careful not to throw anything away. We're going to undo all that. Your plunger is going to come fully extended. Go ahead and make your life easier and extend your push your plunger in all the way. Then you're going to take your bag of saline, we're going to hook that up to our tubing, and next we're going to turn our attention to the transducer, which is this piece right here. Okay, on the transducer there is a stopcock. Up towards this little blue pigtail is towards our bag of saline. Down away from the pigtail is towards our patient. What we're going to do to prime this is we need to prime the whole line. So all we're going to do is we're going to pull our little pigtail, and if you pull it, you will see that water or saline starts to flow through our tubing. I like to fill my drip chamber just a little bit. So we're going to pull our pigtail, let all of the saline prime our tubing until you start getting saline coming out of the end here, which isn't going to happen because of gravity. Okay, so that's our first step with priming the tubing. The second thing we're going to do is you're going to put your saline on your pressure bag. All right. And you're going to go ahead and inflate your pressure bag to an appropriate pressure. Once your pressure bag is all the way to the green, you're going to go ahead and take your stopcock on the little squeezer here, and you're going to move it up so that it's off to the tubing up here. All right. Next thing we're going to do, just to keep things sterile, is this clear cap that's on your tubing, you're going to replace with this opaque blue cap that comes in the art line tubing. All right, so now your transducer is going to look like that. Okay. Now our part as the nurse, we've prepared everything. Now we're going to move on to assisting our physicians when they're placing our line. So why don't we come over this way? Beautiful. Okay, so now what we're going to do is our physician has come and they've placed our catheter in our patient here. All right, usually it's going to look like this. Blood's going to be pulsing out. We're going to hand our tubing to our physician partner, who's going to go ahead and connect our tubing to the catheter. and secure it with a Tegaderm. All right, next, our job as the nurse is going to be to zero our tubing. So we're going to take our attention to our bedside monitor here, which you can see now. Okay, so now we're going to take our attention to our tubing. So what we're going to do is take our pressure cable, and the red end is going to go into a red channel in our patient monitor. The gray end is going to go into the white end of our transducer. And we'll have an art line show up here on our monitor. Now, we currently have a bunch of question marks in our art line, which means that it hasn't been zeroed. So now we're going to do our job as the nurse and go ahead and zero it. So we're going to take our stopcock on our transducer. We're going to move it downwards away so that it's off to our patient. We're going to undo our blue cap here. And at that time, we're going to go to our art line waveform, hit zero art. We hear the beep, and then we see a zero here on our art line. Now we know our art line is zeroed. And if we had a real patient connected to this, then we would see a waveform coming up on our monitor, kind of similar to that. All right. Now let's talk about what we would do if our physician asks us to draw blood from our art line. So let's move back to our patient. Okay, so we're going to move back to our patient and our tubing, like so. Perfect. All right, so the supplies that we're going to need is a vacutainer. We're going to have this, which is called a vamp connector, this guy, a vacutainer, and our lab tubes. All right. So we're going to take our vamp connector out of its package and our vacutainer out of its package, connect them together like so, and then we're going to access this port here, which is closest to our patient. Now, to draw blood from our patient, we're going to take our waste syringe here on our tubing, and we're going to unclick this little tab down here, like that, and then you can go ahead and start to draw back blood from your patient. You're going to fill up your waste container here. So we have all of our waste drawn up in this. Stopcock here is going to go off after you scrub the hub at this location for 10 seconds. Then you can go ahead and place your vamp connector and your vacutainer on the line. And then you can take your tubes, place them on, and as you can see, our blood starts to fill up our tubes. All right, 1, 2, all right, and that's how to draw blood. Now to return what we have wasted, we're going to move the stopcock back to its normal position, which is straight here, and then we're simply just going to go ahead and press this syringe back down. We are going to return all of this waste blood. We hear the click, which means our syringe is secure, and then you're going to take your pigtail on your flush bag and you're going to flush all of this leftover blood that's left over in the tubing back to your patient. So you have a nice clear line. And that's the basics on how to manage an art line.